Hi, I'm Dr. Benulis. I'm a board certified Permanente OBGYN physician practicing in Northern Virginia, and I'm also a mother of three school-age children. So this topic is certainly top of mind for me, and I'm so grateful today to be joined by my two fantastic colleagues, Dr. Christina Brown, a board certified pediatrician, and Dr. Asha Patton-Smith, a board certified child and adolescent psychiatrist. So Dr. Brown, I will pass it to you to tell us a little bit about yourself.
Great. Thank you so much. My name is Dr. Christina Brown. I'm a pediatrician at the Kaiser Permanente in White Marsh, just north of Baltimore. I also have two children. My daughter's starting kindergarten this year, and my son will be starting preschool for the first time. So it's a very important topic, and looking forward to talking with you all today.
Great. Thank you, Dr. Brown. And Dr. Patton-Smith, tell us a little bit about yourself.
Thank you. My name is Dr. Asha Patton-Smith, and I am a board certified child, adolescent, and adult psychiatrist. I work in the Northern Virginia service area in both Burke and Falls Church Medical Centers. And I am the OG of the group because I have a 26-year-old son. So I've been there, done that with regard to pretty much every level of schooling. And I have a soon to be 6-year-old fur baby named Sophie. So happy to be here.
Thank you both so much. And we're looking forward to your questions. So if you're watching live, please post them in the comments on Facebook. So it's hard to believe it's that time of year again, back to school. The past couple of years, families have gone through so many changes and transitions. And I think this year there is that increased level of stress and anxiety just because of all the uncertainties that still lie ahead. So I'm very grateful, Dr. Brown and Dr. Patton-Smith, to have you answer some questions for us. How can we help get our families off to a great start with calm mornings and open communication? So let's go ahead and dive right in. Dr. Patton-Smith, I'll start with you. Can you speak to the importance of establishing routines in the days and weeks, prior to when school starts, or some people are already back in school? How do you kind of get that quickly back on track at this point?
Yes, this is a very important basic principle to have those calm mornings that you spoke about. I think for parents and caregivers, it's important to understand that it's never too late to start. We do have some kids that are back in school already, some kids that are getting ready to go back to school, and some kids that have been in school for several weeks. Ideally, we start a routine of getting to bed at a specific time and waking up generally at a specific time within 2 weeks of the start of any type of change. So 2 weeks before the school year. But for those that haven't gotten started yet, like I said, it is never too late. It's important to have a designated bedtime, a designated time to wake up, and start getting meal times under more control with regard to structure. So breakfast, some sort of lunch time, especially if you haven't started school yet, and then ideally a family meal time or dinner of some kind. That structure is very important for everyone, but especially for children and adolescents, to get them in the flow of what the school year is going to start out like or what it currently is, and to allow for them to feel comfortable with what's happening during the day. Sleep is so important. And so we have to start tonight, if we have not started, with pushing that bedtime earlier so that kids are getting that 7 to 9 hours of sleep to be able to really start the day in a balanced way where they are fully relaxed, fully able to concentrate, and ready to do what they need to do during the school day.
Yeah, and I have two teenagers. Any tips, particularly for those teenagers whose body clocks have shifted and just have a hard time going to sleep earlier?
It really takes some time. So if you just starting, you're not going to notice a significant difference tonight or tomorrow morning. But we have to really start for a lot of the teenagers with limiting that screen time in the evenings. Now we know with regard to screen time in general that for anyone under the age of 2, there's no recommendation for screen time, no screens really. 2 to 5, we're looking at an hour a day of screen time. But in the school age population, so 6 to 18, 2 hours per day, not consecutive, is what the recommendation is. And so for a lot of my teenagers, they are using screens up until the time that they are supposed to be going to bed, or while you think they're sleeping, they're using screens. And for the summer, obviously there, can be some wiggle room. But as we start the year, that I think is paramount to really getting the bedtime regulated and started. So if you have to lock the screen, take the phone, whatever you can negotiate with your teen. But really, a lot of our challenges with regard to sleep, especially with our teenagers, are behavioral patterns established with excessive use of screens, primarily in the evening and at night.
Yeah, that's such a good point. And I think people kind of let the screen time limitations go a little bit during COVID, right?
Yes,
Dr.
we
Brown,
have.
you are nodding your head. I
Yes,
think you've
I'm
probably
nodding.
had this conversation a million times a day, right?
Yes, just
Yeah.
just yesterday I had a parent say, "Can you believe he was up until 2 in the morning?" I said, "What was he doing?" They said, "Playing on his cell phone." And so if children can't make their own boundary with it, parents need to set the boundary. Really, the phone should be kept outside of the room where they're trying to sleep. There's no reason for them to have it in there as a temptation. In the phones, they're bright and shiny and interesting, always showing you something new. So they're naturally kind of addictive in that way. So we have to set the boundaries for them if they can't, make their own.
Exactly. And it is tough. I mean, Dr. Brown, you bring up some great points. It's extremely tough sometimes to be the parent and not the parent friend.
Yes.
But as you said, it really is up to us as parents and caregivers to set that limit. I have just a little story that I'd like to share with a patient, or about a patient of mine that I saw this week that has had some issues historically since the pandemic of getting back to school. And this particular patient was able to start school on time on Monday. And so we were super excited. And one of the challenges has been really trying to negotiate screen time throughout the last 2 years since kind of COVID started. And part of the challenge was the parents had challenges initially taking away the phone. They took away the phone. And then the patient said, well, what if I need to contact you? What if there's an emergency? What if I can't get up? So the parents got a flip phone that only has the ability to call, to negotiate taking away the phone and making the child feel comfortable that if for some reason something happened in the room and this particular patient was not able to get out, there was still the opportunity to call for an emergency. So as parents, we have to be creative and we have to figure out what works best, but we got to take those phones away and the electronics.
Exactly. And I think parents don't understand maybe that the blue light coming from these screens acts like daytime. So, when their head tries to hit the pillow at 2 in the morning, their body thinks it's noon. So it's a big challenge. So I often talk about trying to move up the bedtime by half hour at a time so they can get more used to it. I had another thought about the routines, the eating routines that you were talking about earlier. I have young ones on my mind since my daughter's starting kindergarten, and something I hadn't thought of before, making sure that her lunches include things that she can open on her own. And
Mm.
so building that confidence and practicing with it at home before we start school can help her as well.
Those are all fantastic points. Thank you. And, speaking of things that may have gotten a little bit off track during COVID that we need to get back to, vaccinations. Dr. Brown, what are you telling your families about the importance of routine vaccinations, especially as we are heading back to school?
Yeah, so many children heading back to school are behind on their immunizations, but we can get them back on track for sure. Those routine well visits are so important to go over your routines with your sleep and eating habits, and then also do the vaccines following the CDC, recommended vaccine schedule. So if you've been to your visits, you should be up to date, but definitely check with your pediatrician's office if you're concerned about it. it. At 4 years old, before starting kindergarten, we do recommend to do our booster vaccines for measles, mumps, rubella, chickenpox, tetanus, whooping cough, polio. It's a lot all at once, but it's usually 2 vaccines combined together, so it's not so many pokes. So, and then for the 7th graders, they do need to have up-to-date Tdap, so that's the tetanus, diphtheria, pertussis, as well as a bacterial meningitis vaccine before they're starting 7th grade. So those are important to do. The COVID vaccine, everyone 6 months and up is now eligible for that. And I do encourage everyone who is eligible to get vaccinated. We could talk a whole hour just about this. And if families are interested, you can check out some of our previous Facebook Lives about this topic. But the main message here is that the COVID vaccine is safe and effective, and it's the best way to protect your children and your families and your community against the spread of COVID-19.
Yep. And how about flu vaccine?
Yes, flu season is right around the corner. So we've been very lucky the past couple of years. We've had very mild flu seasons. I've barely seen any flu. The problem is we've been looking at information from Australia, and we look to the Southern Hemisphere to predict how our flu season might be, and they're worried it will be a rough flu season, especially higher rates among those 3 to 5-year-olds, because they have no natural immunity against flu. So they haven't seen it before, haven't really been exposed to it so much. So, but flu is different than COVID, and that children and babies are much more high risk with flu, the elderly and also those with certain medical conditions. So everyone 6 months and up who is eligible should get the flu vaccine, and that also includes pregnant women, so they can protect, their newborns once they are born, since they won't be eligible until they're at least 6 months. So the flu vaccine, it's not perfect, right? It doesn't prevent every single case of flu, but the point is that it decreases the severe illness, decreases your risk of getting hospitalized, decreases your risk of dying from flu. It's a very serious illness. We forget this, many die each year from flu. So it's the best way to protect yourself. And children who are younger than 8, if they've only ever had 1 flu shot, or if they've never had it before, they should actually get 2 this year. So it takes you a little bit longer. It's got to be spaced apart by a month. So you can get it, usually most offices have it after September 1st. So you can get it now, and then again a month from now to be considered immune for flu.
Yep. All right, great points. And then moving on to masking, I think there's no consistency, right? I think some school districts are requiring masks, most are not, and most school districts masks are optional. How do you, and I'll throw this question out to both of you, how do we talk to families about whether or not to mask, and how to, sort of support kids not stigmatizing or judging each other or questioning each other's family decisions around masking?
Yeah, so I think it comes back to, at the basics, being a role model for your children about respecting differences and honoring each other's choices. And, each family has to make their own decision on this. Even amongst pediatricians, sometimes there are different recommendations, but, it also is partially dependent on the age of the child. I know, my daughter masked all of preschool last year. She may have been the only one in her class. There was no one bullying her or talking to her about it, as far as I know, but she also, she took it off for snacks. She took it off outside. She was always touching her face. I don't know how well she was really wearing it. So I think for those that are wearing it, should, still first and foremost, make sure everyone's doing really good hand washing techniques, like before they're eating, after they're eating, after using the bathroom, when they get home from school, when they're touching so hand washing is still extremely important. important. And then with your mask, making sure you're not touching it and, replacing it or, cleaning it frequently, good mask hygiene as well. And each family, can make their individual choice about it. We do know that if you wear, a well-fitting mask and you wear it well, then you can decrease your risk of COVID-19 and decrease the spread. So masks are still important, and families can make their decisions about that.
Completely agree with Dr. Brown, and it really needs to be a family decision, especially because, as you said, most school systems are having mask optional. I think what is important is for those kids that are choosing to continue to wear a mask, because there are some at various ages that just feel more comfortable wearing a mask. And that's okay. So I think a lot of times for the kids I see, there is some concern about their desire to want to wear a mask, especially in that high school population, that adolescent population, but being fearful of what indeed peers will say if they are masking. And what I'm finding, I mean, school is just starting, is that the majority of the kids that I'm seeing at school are choosing not to wear masks. But for those that are choosing because of their comfort level, because of whatever challenges they may have with regard to their immunity, at least at this point, a lot of kids just kind of go with the flow. And there hasn't been any challenges with teasing or having kids feel uncomfortable, whether they're masked or not. So I think we've been doing this so long. And when we had last year, a lot of school systems initially requiring masks, and then a lot of the masking standards were more optional. I think this year, with the kind of optional mask, kids are just used to it. And as Dr. Brown, you said about your daughter, a lot of kids have gone to school with masks and don't know any different, our younger kids. So I think that and peer pressure with regard to mask is not as significant an issue as I thought it would be at the start of this school year, but really it should be a family and child decision.
Yeah. Yeah. And we have to make sure like how we're talking about masks and vaccines even too in front of our children. They're listening all the time. So no one should be stigmatized for not vaccinating. We can, there's always room for education and for
Absolutely.
discussion and all of that. But, no judgment, no bullying, no, none of the hatred, so that's really important too.
Another great point, because I always tell my parents and caregivers, you can show your kids better than you can tell your kids. So what you are telling them really needs to coincide with what they are seeing with regard to just how you were interacting with other people. Sometimes what you believe may be different than what your peer believes, but that's okay. And it's important to, as you said, have a very positive environment that's understanding and accepting of different views and different values with regard to all subjects in general.
Mhm.
Yeah, absolutely. This translates to everything, right? Beyond masking and COVID. Yeah, those are fantastic points. And Dr. Patton Smith, I've been hearing from a lot of my patients, right, who are moms, a lot of frustration, a lot of anxiety around just the ongoing changes happening in schools, and now we're dealing with some teacher shortages at some schools, and still a lot of ongoing uncertainty. How do you help parents and children manage that sort of uncertainty and anxiety?
Great point, and something that has been ongoing, right, since the pandemic. And unfortunately, I think the only constant is change as we start the school year as well, especially with regard to some of the classrooms and teachers and things of that nature. So I'm hearing this with my population as well. I think first and foremost, as a parent or caregiver, again, you can show them better than you can tell them. So if you are super anxious about the start of the school year, or freaking out because the teacher that you thought was going to be your child's teacher is now not your child's teacher, your child is going to absorb that energy. And so it's important to just be as open and as honest and as balanced as a parent with regard to these concerns, with regard to the school, with regard to who may not be teaching for the year. The other thing is keeping an open line of communication with your kids, and it needs to be open and non-judgmental. So if your child's expressing concerns about COVID, about the fact that they don't like their teacher, about the fact that their teacher hasn't been assigned and they've started with a long-term sub, listen, get their perspective, and support them in this process of figuring out how to decrease that anxiety or how to work with the situation they have. More often than not, parents mean very well, and they say, oh, it's not going to be a big deal, or they'll figure it out by the time mid-year is, don't even worry about it. What the parent is trying to do is really support their child and have them look optimistically on what the options are. But what the child is hearing is that their feelings are being dismissed. And so it's important to make sure as a parent that you're openly listening, asking questions, and making sure that you understand your child's perspective. A lot of what I see actually is the opposite. The parent is anxious and feels that their child is going to be anxious about a situation. And when you talk with the child, they don't have any concerns about what's happening, if they're going to have the teacher that they thought they were going to have, if they're going to have a teacher at all, or will there be someone else standing in. A lot of times we as parents and caregivers transfer some of our concerns onto our child and assume they have the same perspective, which is why as a parent, being an open listener is so important throughout your child's life, but especially when you're dealing with concerns with regard to the start of school and changes that may or may not happen this year.
Yeah, this is all ringing very true for me as well. I feel like you're talking directly to me as a mom, and it's really important to acknowledge like our own humanity in this. And yesterday was my daughter's back to school day, meet the teacher, and I wasn't able to go because I was at work. She had a great day there with her grandmother, but I came home, is she going to make friends this year? Are we going to meet other people? Are they going to see how awesome that she is, through her quirkiness? And it was like, she's going to be great. We've been, preparing her whole life for who she is, and,
Yes.
making her helping her be the person that she is, and, a confident, quirky little girl, and she's going to be great. And, I have to check my own feelings there and acknowledge them, and after she goes to sleep, kind of acknowledge them. So it's not in front of
Yes.
her and she's not seeing that. And, she's going to be great. I know it. So
Beautifully, beautifully said, Dr. Brown. It's important. I mean, we as parents just have more experience. And so that can be positive, and that can
yes.
sometimes be negative with regard to some of the anxieties or concerns we have. So when we're looking at what concerns our child has, we're looking through our child lens, not through our parent lens, because a lot of times those lenses are completely different when you look through them.
Exactly.
Yeah, great points. And what about the kids? Kind of again, getting back to my own experience with teenagers, kids who don't necessarily open up, but you may suspect just based on other behaviors that something is up. And I'm sure you both have great tips. I would say, like for me personally, not like they don't tend to open up if I'm asking them direct questions, but if I just try to spend time doing other activities. Let's go for a walk, or sometimes just in the car where we're not face to face and they're pressured with a question, that they may open up a little bit more. But I am open to any tips that either of you have, and I'm sure this is a common question, again, especially for those older kids.
Absolutely, absolutely. The teenage population is one of my favorite populations to work with. But as a parent, it can be tough because, as we know, where a teenager is developmentally is it's time for them to start separating from their parents. It's time for them to be able to establish their own autonomy and their own ability to kind of look at the world and have the need to be more with the group and more with their friend group. That is where they're supposed to be developmentally. As a parent, it is a challenge because you're still the parent. and this is a teenager that doesn't have a fully developed prefrontal cortex, so they need some help in navigating a lot of interactions and in helping them understand some of their potential for impulsive choices. But you have to give them the scaffolding to be able to make mistakes and learn. And for parents in general of younger kids, I say get in the practice of just asking a combination of open and direct questions on an ongoing basis, and be prepared with what the answers are, and don't judge the answers. So this should start very early of, hey, how was school? Or, what do you think about this new kid in your class, or whatever is happening? And just listen again, not with the parent lens, but just openly asking more questions, really being present with your child. If that's not something that's been directly established or was directly established, and as your child is moving into teenage years or as a teenager, that has kind of been shut down because you're the annoying mom, dad, caregiver that, just asks these silly questions and my mom is so annoying. If that is what's happening, which is usually the norm, then just being consistent with, hey, how was your day? And if you get the one word answer or the mumble or why do you keep asking me that and a door slam, that's fine. You're the consistent person that comes back and says, just check and see what's going on. Or sometimes self-disclosing, gosh, my day was really challenging today. How was yours? To really kind of model what you want to see with your child, especially your teenager, and being able to disclose and being able to move forward, even if they didn't have a great day. As you said, Dr. Manulis, it's great to get them out of their element, so out of their room, and have a walk, or maybe you're spending 15 minutes on that video game that you completely don't understand, and having them explain it to you, and have that be an opportunity for them to teach you a skill, and you can also get some information from them and really have a very beautiful interaction. Family mealtime is another great time for a lot of my families that are able to do that on a regular basis. And I know it's hard with all kinds of scheduling, especially with our older kids. That can be a great time to be able to talk about one win of the day and one thing that maybe was an area of opportunity. But the consistency for parents and caregivers in checking with your children, especially your teens, I think is really what makes the difference. If you keep plugging along slowly but surely, you'll get your kids to be able to open up more because they know you're consistently there, you care, and you are listening to them in a non-judgmental space, which is really what the key is for our teenagers, especially, to open up.
Yeah, and I want to highlight too what you said about being present. Those were all really, really good strategies for talking to teens. And family mealtime is one thing if you're, all present and listening. It's another thing if you're all on your phones, or
Yeah.
the parent, even the parent is just on their phones. Like, how was your day? And then you can tell that they're thinking about their entire to-do list for the week rather than
Yes.
really hearing their child. And they didn't have a good day, going more into it and giving them your time and spending that quality time together, and trying to reserve their own parental screen time for, later in the evening when the children are asleep or working on something else. So being really present with your children, because they can tell and they need your
Absolutely.
attention.
Uh,
They can
such a,
so tell.
yeah,
Yes.
great reminder. I think we all catch ourselves doing it, right?
Yeah.
And those are
Yeah.
like little
Yes.
moments, checking. Yeah. Yeah. I love that. And, you both brought up mealtime. And I think, the challenge back to school is now they're in school. Now there's those evening activities, right? How do you make that happen? And what, is it okay if it only happens a couple times a week? Do you still make
Yeah.
it a priority, right?
Great. That's a great point. And what I'm glad you brought up, do the best you can. No one's perfect. And, if your goal is, Monday through Friday, you're eating meals together as a family, and you're not able to do that because the soccer practice is at 7 for one and, 8:30 in the evening for the other, or whatever activities are going on, that's okay. It is quality more than quantity, ideally. At the same time, I know in my own family, my son was a soccer player throughout up until college. And so he had late practices as he moved into high school. So we ate later. Not ideal for me and my digestive system,
Mhm.
but it was what we did to be able to have our mealtime as a family and work around our child's schedule. Now, we just had one child. Much easier to work around one child's schedule than two, three, four, or ongoing. So sometimes a lot of my families, the weekends are really the only time they're able to do it consistently, or on that Friday night if there's not a game or other things going on. But really try to make it a priority when it can happen, but don't beat yourself up over it. I mean, we do the best we can to try to create that structured environment, but because of competing forces, because we want our kids to be well-rounded and be able to interact in these different spaces, sometimes that doesn't work as well. And we do the best that we can because that's all we can do.
Yeah, planning the meals for the week of ahead of time can be helpful too if you're able to do that. And you can involve the kids in that too. Ask them what they want to eat, have them help make the grocery list, and things happen, other things come up. We all know that, eating out and fast food is a part of our life, but there are different ways to go out about doing that in a healthy way, healthier way as well. So, getting the grilled chicken instead of the fried chicken, or, getting the salad instead of the burger, or just picking apple slices as your side instead of the French fries. Little changes that can all add up and be helpful over time. There's also, different crock pot recipes that families do sometimes, or all sorts of things online that you can find for how to make something big for the week and then have leftovers later during the week to make your weeknights go more smoothly.
Yep, definitely. And how about any tips on making those mornings go more smoothly? Those, stressful trying to get out the door. How do we get that calm morning to get our kids off to a great start before they're even on the bus or on the way to school?
The calm morning is key. Really, it helps provide the foundation for the day. And that's for all of us, whether it be our kids or for us as parents and caregivers. And I think Dr. Brown brought up a great point in general. Pre-planning is part of what makes a morning calm. So as a parent, it may mean that you need to get up a little earlier to, especially with younger kids, help prepare the lunches. If you have to get ready to get out, maybe you have to get up a little bit earlier to start your process or have your time to get that quality time to get your day going before the kids. Those are kind of a part of it. The other part is to really establish that morning routine and get as much done at night as you can get done to be able to have a less stressful morning. So if part of the lunches can be packed at night, again, especially for younger kids, if it can be clear that the book bag is packed and ready to go at night. If the outfit of the day that we're wearing for the next day is out and approved at night, all those things are things that can help provide a morning that is less stressful. And talk to your kids about what they are looking for in the morning, what they need to do in the morning, and what are some things that they can do in the evening. It's a lot easier for the younger kids to kind of set the stage as to how it's going to work. For the older kids, it can be a little bit more challenging overall for that to happen. But partner with your kids, especially if the morning is very hectic, and see what you can do with their input in making things just much calmer, making sure that you're modeling what you want to see. If you're running around the house all, out of whack, looking all frazzled, it doesn't help set the tone, right? So you as the parent have to be the first person that is the model in that, but also making sure that your kids are part of the solution and not the problem. And if it doesn't go well, or if there are changes that need to be made, trying as a parent to be as calm as possible, because yelling or getting anxious or upset just gets your child more revved up and can make things just even more stressful than they have to be. If your child doesn't understand why the pre-planning is needed, talking with them about the importance of setting the tone for the day, providing the foundation for the day, and how that can help the day be more smooth, can just help them understand this throughout life and not specific to getting ready for school.
I'm also a huge fan of breakfast as well. So, leaving enough time for it. And it doesn't have to be anything elaborate. It can even be a granola bar or a Greek yogurt or something to just kickstart your brain in the morning to set you up for a great day, help you focus in class without your, stomach grumbling. And, it's especially important. So, should not be something that gets skipped. But those are a lot of great tips.
Yeah.
Such a good point with breakfast. Something that I don't follow as I should myself, but it is extremely important. I think one thing parents need to understand is breakfast doesn't have to be breakfast food. A lot of times they'll say, "Oh, my kid doesn't eat pancakes or eggs."
Leftover
That's
dinner
okay.
works.
Leftover
It's
dinner
something.
works. It can still be
Something.
breakfast. So make sure that you're very open as to what breakfast needs to look like with regard to it being balanced, but it doesn't have to be the traditional eggs and bacon.
Yeah.
Right. Right.
Great points. Great points. So, we all expect there's going to be some bumps in the road, right? And some transitional challenges in those first, week or two back to school. At what point, though, should we be beyond the transitional challenges, and should we have a level of concern that maybe we need a little bit more help with getting our children where they should be?
Each parent and caregiver knows their child. And kind of the catch all is if you see anything different that is consistently happening for 2 weeks or more, it's kind of time to check in. For most kids, it takes about 2 to 4 weeks for them to get used to any type of change. So even if they've been at the school, it's not a new school year for them with regard to changing schools, it still takes about 2 weeks for most kids. But some kids need a little longer, some kids transition in a much shorter period of time, but that's kind of the rule of thumb. If you're seeing changes in behavior, changes in sleep, changes in appetite, excessive irritability, patients or kids that are being very withdrawn more than what their normal is, being aggressive, having significant mood swings, not getting to school, not doing well in school as far as completing assignments, having thoughts or saying that they don't want to be around anymore. These are all telltale signs that there's something happening. You need to talk with your kid, and then you need to talk with your child's pediatrician, family practitioner, and or mental health provider. If you don't have a mental health provider, start with your child's primary care provider and then move from there. So, we give kids time to transition, but if you see something as a parent that you're concerned about, you can also reach out to the school. If sometimes you may see something at home that is not being seen at school, which may speak to some challenges in the home dynamic or vice versa. So again, establishing that open line of communication with your new school team, the new teachers, principal, guidance counselors, social workers, making sure you're aware of who they are, making sure your child is aware of who they are, because really the school is an added partner and kind of that second set of eyes to see your child in the out of home environment and be able to talk to you about what concerns they may be seeing as well.
Right, exactly. That's what we are all here for, is to help parents navigate this. So don't hesitate to talk to your child's doctor if you're having any concerns about it, and we can take some time to speak with them individually as well if it's something that they may not feel comfortable talking about with the parent for whatever reason. And, we will always disclose if we are concerned about their safety and, help make a plan for them to help get through the tough time together.
Right.
Great. Well, thank you both so much. We are unfortunately just about out of time, but Dr. Brown, Dr. Patton-Smith, just thank you so much for your insights, your expertise. I know I've learned a lot and gotten a lot of good reminders that hopefully will help my family. But we wish all of you a very healthy and calm start to the school year.